The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Welcome back to the Virtual Curbside. This is your host, Paul Wirkus, back this week with Megan Jensen and Nicole Holland from the Intermountain Eating Disorders Leadership Team. Welcome back, Megan and Nicole.
Glad to be back.
Thank you.
Have either of you developed any disclosures we should talk about?
Not this time.
How about you, Nicole?
Still unpaid.
All right.
No.
For anyone who has any side hustles to suggest for Nicole, please send your suggestions to sidehustles@vcurb.com.
I'll take them.
We'll collect those for our guests. Last week we talked about trying to build a good foundation for healthy eating patterns. This week we want to talk a little bit about some of the things that begin to pose challenges in the maintenance of healthy eating patterns. Let's talk about a topic that I think we all feel fairly neutral about, and that's the issue of social media. What effects does social media have on healthy eating patterns?
Woof, that could be its own podcast. I'll share something that is going on currently there, especially in the adolescent population. So with the social media can be very, very good. It can be very, very harmful in a lot of different ways, not just with eating disorders, but that currently there's actually a lawsuit going on. It's been going on for a few years now, and it's involving the eating disorder community nationwide, where they found that with adolescents, with how the algorithms work with major social media platforms, if they were searching like eating disorder recovery content, usually it was within, I want to say it was 1 to 2 minutes with the algorithm, they would be fed pro eating disorder content. They call it pro Mia for pro bulimia or pro Annie for pro anorexia. There are lawsuits going on with potentially the eating disorder causing needing to go into treatment. And so this is currently going on right now because it's a major issue, major concern within the adolescent community, especially with adolescent females.
So what do we suggest to families based on that?
Once again, it's own podcast. I think monitoring to the best of your ability is important. Ideally, it'd be like no social media, but I think on the flip side, are we doing harm with that, right? With other aspects of life and making sure that they feel connected. It's crazy to think about the pandemic was 5 years ago, but we're definitely still feeling the effects of that. And especially in eating disorder treatment. And so wanting people to feel connected, but monitoring, but also educating our kiddos about these are things that could potentially be harmful, and making sure that if they start to see content that maybe they talk to a trusted adult about it, or they hit the hide, don't show me these posts again button. I do that a lot as a dietitian. I don't know if the algorithm just assumes, oh yeah, like she must love diet culture because she's a dietitian. And so I just get it constantly. And so half my day, if I'm on social media, is just spent clicking not relevant, don't show me this again, and teaching kiddos that that's an option, that they can do that.
Paul, so I have a couple bonus kiddos that are teenage girls. And this has been an interesting one to battle firsthand, because I think one of the hardest things about nutrition content is there's so much of it. And some of it is good, and some of it is true but not relevant, and then some of it is just not good. It's so hard because you get bombarded as an adolescent, as a parent. And I think the hard thing as a parent is there's an onus of educating your kids, and that can feel really heavy, because if they come to you with content like, oh, I saw this on social media that I should only eat 1,000 calories a day, you have to be able to educate them. No, that's not true. And this is in no way a plug, but maybe this is a plug. Meet with a dietitian. Take your kids in and meet with a dietitian and try to get some actual scientific backed education versus what's seen on pop culture. Because another thing that's really popular nowadays are these whole what I eat in a day series. And it will go through a celebrity or someone who's popular and show their eating regimen for a day. And there's so much variety to our own genetics and what our own body needs that isn't relevant for anyone else. That might be what that person needs nutritionally, but for a child or an adolescent to see that, and they might not think it's bad. They might not be like, oh, this is going to harm my mental health. But they take that in and like, oh, this is what I should be eating, or this is the number of calories that I should be eating. And then they focus on that information. And I think as parents, we have to educate them about what is true and what's healthy. And if that feels overwhelming, I really do think going to see a dietitian with your teenager, even if they haven't developed what you would see as disordered eating habits yet, can help prevent that, just to give them some education that is backed by science and not just a pop culture what I eat in a day series.
Because you're right, at the adult level as well, there is so much conversation about what diet you should be eating. Should it be a keto diet? Should it be a paleo diet? Should it be whatever sort of thing? And it feels like we move farther and farther away from what you were talking about last week, Megan, with an intuitive diet, and what both of you were talking about with a well rounded diet, looking to get a lot of different kinds of things. That it's almost like there's too much information to be able to interpret as a family sometimes.
Absolutely. I like that you brought that up, Nicole, that there's so much information, a lot of it misinformation. And definitely there are a lot of people on social media who are educated. And so trying to have conversations with kiddos about the importance of where is your information coming from, right? Is it from a dietitian? There are even some social media accounts that are more exercise science based in terms of like that's who is running the account, but also very much informed with diet and nutrition. And there are people that are well educated that are on social media that are trying to kind of break through all the misinformation. It's hard without actively searching for it. It's hard to find it because you're just presented with all this other misinformation and just kind of bombarded with it. But it's there. And helping kiddos find it, I think, is important.
It's there, but the algorithm doesn't necessarily take you there. And that's the hard part. The algorithm is very good at figuring out what tickles you. And then that's what you get. You linger on something longer or you press on it, and suddenly you're getting more and more. And I think for somebody who's vulnerable, there's so much more vulnerability that ends up coming into the feed. It's a really tough thing to navigate, I think.
Yeah, I know some parents will put like timers on social media of how long you can stay on there. You could take the route that I took and just look up videos of golden retrievers just because I love it and they're fun and they make me laugh. And so my algorithm sends me just golden retriever
Right.
videos all day.
Right.
And I love it.
Yeah, one of the challenges, though, is that these are personal devices. Typically, it's not the family sitting in the living room gathered around the TV making healthy choices together. So, yeah, so much to think about. A couple of months ago, we talked about Jonathan Haidt's book about the evidence that social media increases anxiety generally, and I think it's a tough challenge. Let's talk about one of the things that we struggle with sometimes, and that's that we discuss growth charts with patients who come in. How do we talk about growth charts in the most productive way to help people develop good and healthy attitudes toward food and toward their bodies and toward eating?
Yeah. When parents come in with their kiddos who might be struggling with disordered eating, growth charts are I generally brought up by parents. I usually ask for the growth chart so I can just kind of see if they've lost weight, where was their body kind of hanging out previously? You know, what is the growth chart indicating to us? But oftentimes parents are concerned because they see the growth chart and they see the percentile, and usually I see parent concerns if they're under the growth chart, as in they're not on the growth chart, or maybe above like the 75th, 80th percentile. I start seeing concerns there as well. And it's interesting because oftentimes having conversations with parents about, okay, what are the body types? Kind of where did you kind of sit at? Where did your biological parents kind of sit at on the growth charts? And There's a genetic component there. Oftentimes go right before puberty, or with the pandemic, I noticed as well, there were increases leading up to puberty or with just the stress of the pandemic. And so oftentimes when we talk about growth charts, I generally focus on where is the body telling us it likes to hang out? Because no matter what I do or no matter what you do as a parent, eventually the body's going to try to get back to that. And so why don't we work with the body instead of against it and kind of focus on behaviors and healthy lifestyle instead of a specific number. My dad growing up, he's an engineer, and he would always say, "What does the data tell you?" Right? You have one data point. If we're looking at a growth chart, that's one data point. What about all these other data points? What are we eating? What is our movement looking like? Where are we at psychologically? Where are we at in pubertal development? And taking all of these points and not focusing on a single trend or a single data point with everything else that impacts health.
I was just going to add, there's an approach that we hear more in the adult population called health at every size. And this hasn't really made its way into pediatrics as much, I don't think. But I think that's a good approach to have as a provider for kids as well, as this idea of, like Megan said, focusing on behaviors, number one, but also making sure that we have a neutral stance in regards to body size too. For example, as we get a larger body size, assuming that because of that, they're going to have poor health, which in reality, you see on the flip side, when we have patients come in with underweight body sizes, their health is just as compromised and their mental health as well. So understanding that there is really a spectrum of healthy sizes of bodies and focusing on the behavior instead of the body size. For example, in the health at every size approach, exercise is used in a way that celebrates your body's abilities. So instead of focusing on like, oh, I need to exercise to be a certain body size or type or form, it's how does movement help me feel good in my body, and what can I focus on that my body does that makes me happy, whether it's dancing or running or playing soccer or whatever that is. So just having a view of health that is spectrum, I think, is really important, whether that's an explicit or implicit bias as providers, avoiding this idea of we need to have a certain size for a child for them to be at their best health overall.
There's a lot of incentivization sometimes by health plans, for instance, in making sure that you've discussed or at least made note of someone's BMI. Is that fraught?
I don't love BMI for a lot of reasons. I think
Right?
on either extreme, it can be indicative of perhaps something going on. But in reality, in pediatrics, it's not accurate. It's like once you take away the populations that BMI is not accurate for, you're pretty much left with like middle-aged adults in good health. Like it's once you take away all of that. But in pediatrics, we're talking about growing and developing bodies. And the BMI and the weight can fluctuate so much as kiddos grow up, and then they kind of grow out and they grow up and kind of out again, and it fluctuates so much. And I understand that oftentimes required for documentation to put it in there, and I think that's more probably just standardized information. And when you look at the BMI as like a population as a whole, there's information that you can gather from that. I definitely believe, and I know that pediatricians believe in individualized healthcare. Like I said, if we have the average BMI of the pediatric population as a whole, would it tell us something? Maybe, right? But that individualized approach of, yeah, we know maybe what the BMI Z score is, and maybe that gives us some information, but it's not the be all end all of this kiddo is healthy or not. Once again, it's one data point, right, out of several that we need to take into account and not make assumptions based on one number.
Is there truth to the thought that talking about obesity may lead to more dysfunctional approaches to eating? As a provider, is that something I should tread lightly about?
I definitely take the approach of yes, focusing on healthy habits. There are so many factors within the last 10 years for sure. I can't remember the exact year, but the And this is in the adult population, so not pediatrics, but the same information applies. The UK's equivalent to the like Health and Human Services. They had this huge kind of article and kind of plan come out, strategies to help work on decreasing and prevent obesity in their country. And they came out with this obesity systems map to show all of the things that impact someone's weight. And let me tell you, it is the most complicated diagram I've ever seen in my entire life. And it's a simplified version, which is even bizarre. It's shocking how complicated this is. And they even make a note that this is not an exhaustive, diagram of all the things that impact it. But there's just genetics, there's biological health in general, there's mental health, there's a psychological, there's the whole food system side of things. We touched on this last time about what is affordable, what is convenient, how busy is our lifestyle, do we have safe places to exercise and to move our body? Are the kiddos at home alone while mom and dad are at work after school? There are all these things that impact someone's weight. When we talk about obesity prevention, or we talk about decreasing obesity, or we see a child's, BMI Z-score, we need to remember all of these other factors where we can provide them with information of here's what we do to decrease your weight. Here's what we do to decrease your BMI. This is a problem. But a lot of times these families feel powerless because of all these other reasons why that weight might be the way that it is. And then we also don't want to ignore maybe that's just the weight that their body likes to be at. And so once again, on the healthy habits, doing what we can given the circumstances and really trying to figure out more about the family circumstances coming into that appointment to really figure out why is this the way that it is and being okay with it being the way that it is, or trying to figure out what's going on. I've had teenagers come in and they have a BMI Z-score of 3 or 4, which means they're in a larger body, and we start talking and they come to me for weight management and I'm like, you have an eating disorder. We need to treat this. This isn't obesity management. This is we need to treat the eating disorder, and really trying to get the whole picture of what's going on.
That's very helpful. I want to talk about just one more thing, and then next week is when we're hoping then to how do we tackle the notion of an eating disorder. We talked last week about the role of upbringing and family in attitude toward food. Any other pitfalls you wanted to mention this week about family dynamics that may have an effect on development of an eating disorder?
Do you have thoughts, Nicole?
Oh, man. Well, I touched on this a little bit last week. I think there are so many factors that can contribute to an eating disorder, from personality type to family dynamics to trauma. And another component of it is eating disorders also are along a very wide spectrum. Even now, we're adding new classifications that have not primarily been viewed as eating disorders. ARFID being one of them, avoidant restrictant food intake disorder, that we see a lot with neurodivergent communities now that we didn't recognize before. And so I think narrowing it down to A equals B is really hard with an eating disorder because it's such an interwebbed thing. I think the biggest thing as far as prevention, in my view, is parents having a healthy attitude towards food, and also parents having a healthy attitude towards their child's body size. And we've made it a rule in our family: you don't comment on someone's body size. You don't comment on their shape, the way their hair is, anything. If it's not your body, you don't comment on it, because we shouldn't be talking about it. And so having this education of acceptance of all body sizes and shapes, and also trying to teach that balanced approach to nutrition, I think it's more of an intentional prevention. There's nothing to really say, if this happens, this will lead to an eating disorder. I think just as parents, we have to just really be intentional that it is a risk, and we have to take the steps to talk about it. Kind of zooming back just a little bit to social media, sorry, but tying in, I don't think it helps to ignore it or to just be like, well, my kids just won't see it. I think we really have to be intentional in talking about it and saying, hey, this is going to be something that comes up and you're going to see this, or hey, you're going to hear about body weight and your friends are going to talk about this. How do we approach it? Because it's not something they're not going to face. So having that responsibility as a parent to take the initiative to talk about it and prevent it.
Yeah, I think
Very
that's
helpful.
great, Nicole. One
Yes.
other thought I just wanted to add was not only do parents need to recognize and work on their own relationship with food, but also their relationship with their body. I remember growing up, and I say this, I've already talked to my parents about this, so it wouldn't be like new information if they listened to the podcast, but like growing up, my parents were in larger bodies, and my entire childhood were desperately trying to change that. They never said anything negative about my body. I mean, my siblings did, but that's sibling stuff, I guess, and we've talked about that as well. But I remember my parents saying things about their own bodies, such as, well, I'm fat, I have so much weight to lose. And I remember thinking as a child, looking at my own body and thinking, well, do I? My mom is saying these things about her own body. I don't think she's fat. I don't even know what that means, but I don't think she needs to change anything. And then I would look at my own body and then start questioning things. And then mom and dad would start like changing what they're eating at meals. They're not eating what they prepare for myself and my siblings. And so I would sit and think like, well, is what I'm eating bad? Because they're eating something different. And so working on, not only do we not make comments about other people's bodies, but we need to be really careful about the comments we make about our own bodies in front of children, especially, because that could very well cause some disordered eating behaviors, even though nothing was said about their body. Kiddos pick up on everything, and it can still lead to weight bias, even if it's not about their own body, if that makes sense.
Yeah, and just jumping off of that one more time, I think it's also, as a parent, we can't have our head in the sand approach. Even if I don't talk about my body, my kids are going to go to school and they're going to see movies and they're going to see all sorts of things that are going to have that influence, social media. I think as parents, we have to be intentional about what we say. So it's not even like a, I don't talk about my body at all approach. It's a, hey, isn't it cool how strong your legs are that they can run that fast in soccer? Or isn't it cool that your body is so healthy that it can recover after you've been sick? Isn't it awesome that we have all these foods that can help us do that? And so just really being intentional about not ignoring the topic as well, but really diving into it and making sure that we're proactive. Because eating disorders, I think one of the hardest things about it, there's such a shame and hushness about it that it's almost a don't talk about things. And I think we really have to talk about it. We have to say, hey, teenage girls, are your friends talking about their body size? Are they talking about what they're eating at school or not eating? Let me help provide you with good education so that we can tackle it kind of ahead of the game versus responding to what other people are saying. We need to take the initiative to say, hey, this is what I feel and what I believe about my body and what we should be doing with our body and the foods we eat.
Yeah, that's sort of a pattern of radical self-acceptance instead of compare ourselves and always want to put ourselves in a hierarchy.
Yeah.
I mean, it is tough, though. I often point out that little kids love to be busy and they'll play tag and they run around like nuts. And there comes a point where you have to be good at something to stay physically active. And I think that figuring out how to just embrace who we are and what we do and find joy in that, it seems like there would be a lot of advantage in that. And in families, being able to not feel competitive and not feel comparative with culture at large or with other people, but that, we are who we are, and isn't that wonderful? Yeah.
I'm up for a game of tag after this.
All
If
right.
you guys are.
All right. Well, this has all been very insightful. Next week, we're going to talk about recognizing and responding to eating disorders. Thanks again for your time and your expertise this week. For our listeners, please send your questions to questions@vcurb.com, and we'll deal with those in a couple of weeks. In the meantime, Megan Jensen, Nicole Holland, thank you very much, and hope you agree to come back next week.
Thank
Thanks.
you.
Thanks for joining us. We look forward to getting together again next time. The virtual curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Production design, thanks to Paul Wirkus, who also composed the theme music. See you next time.